Hi, everyone. We're going to start. I know we have a few more people that are going to be coming in, but on the essence of time, we will begin. I'm Marissa Bernstein. For those of you that do not know me, I'm the benefits manager here. Justin Lubenow, he was here in 2019 and did speak about Medicare, and it was a very popular workshop. We also have Rod with us as well, who will be coming in on the later half to discuss important things and items to know. Justin?
Thank you, Marissa. Thanks for having us. And thanks for coming out to the workshop today. I do start the presentation with just a little bit of an introduction, just to let you know about the company and kind of who we are and what we do. I'll keep that as brief as possible so then we can get into the meat of the presentation with Medicare. All right. So Senior Advisors, we're a general agency for Medicare planning. It's my father's business. He's been in the insurance industry about 30 years. He started out in small group benefits. So generally companies like 2 to 100. Most of our groups are like 2 to 10. And as people were aging out of those groups into Medicare, he never really had a solution. He used to tell people to call Blue Cross or call AARP and they'll help you with your Medicare plans. About 15 years ago, one of his friends got him educated on Medicare. He started this general agency for Senior Advisors, and it's actually grown to become one of the largest general agencies in the Northeast for Medicare plans. We have over 25,000 clients across the country. We've got a bunch of 5-star reviews on our website. You can see all the testimonials there. We're also very active in Washington, D.C. with Medicare. So I've been a member of the Medicare Advisory Board for the National Association of Benefits and Insurance Professionals since 2016. So we go to Washington every year. We lobby on behalf of Medicare beneficiaries to help protect and improve the system. I was just there a few weeks ago, and we've got to meet with the House Ways and Means Committee and discuss a couple of key issues there. So we have a few different offices. So we have, we call it North Jersey office in Cranford. And then South Jersey down in Moorestown outside of Philadelphia. And we also have an office out in Phoenix, Arizona. But we're licensed in almost 40 states, so pretty much majority of the country. So if you're planning to move somewhere or you have friends somewhere in another state, we can also help in those other states as well. All right. What do? We really focus on the education. So you're going to see that today. Really just a kind of a Medicare 101 presentation. And then we do help people with the actual enrollment. So we're brokers at the end of the day. We work with all the A-rated insurance companies, so United, Aetna, Blue Cross, Cigna, all the big names out there. We can help you find the right coverage for your situation. And there's no fee to work with us. We're, like I said, a broker, so you pay the same premium whether you go directly to the insurance company or if you work with a broker. All right. So that's a little bit of the background. We're going to jump into the actual presentation. You do have, by the way, for the folks in the room, the printout of the slides, so you can follow along. You can take notes in your folders. If you do have questions, feel free to ask those as we go. So you don't have to hold them to the end. If you want to ask them throughout, that's fine. The way the presentation is broken out, there's kind of 3 different sections. The first one is kind of a 101, different parts of Medicare, when you should be signing up for Medicare, how much you pay the government for Medicare. If you're in a higher income bracket, how much do you pay the government for Medicare? And then the differences between Medicare Advantage plans and Medicare supplements. So we're going to cover those all kind of in Section 1. Section 2 of the presentation is for the Part D prescription drug costs, which can be one of the more confusing parts of Medicare. So we're going to walk through how the Part D plans work with Medicare. There were also some changes made, or the legislation that passed last year in that Inflation Reduction Act in August, that actually impact Medicare prescription drug pricing pretty significantly. So the big impacts are going to happen. There's a couple of impacts this year, but then there's some bigger ones coming next year and in 2025 with prescription drug pricing with Medicare. So we're going to discuss that in Section 2. Section 3, we really just recap the top 5 mistakes that people make on Medicare. So we're going to touch on those in Sections 1 and 2. And then in Section 3 is just a very quick recap of those mistakes. All right. Okay, so what are those parts of Medicare? So Part A of Medicare. What does Part A cover? Hospital, right. The answers are in the slides, right there. Part A covers the hospital benefit. So if you're an inpatient in the hospital, that's going to be under the Part A umbrella for the Medicare coverage. If you get transferred from the hospital into a skilled nursing facility, that's also going to be covered under Part A. So skilled nursing is like a rehab facility, right? It's not, don't get it confused with long-term care. Right, long-term care is going to be like a nursing home or assisted living. That is not covered by Medicare. But skilled nursing, which is like a rehab, let's say you have a stroke or a knee replacement or a hip replacement, you're in the hospital for a few days and you get transferred from the hospital into that rehab facility, that's covered under Medicare Part A. And we're going to get into more details about how that works, but just for now, that's under that Part A umbrella. All right. Part B of Medicare is pretty much everything outside of the hospital. So it's your doctors, your specialists, testing, x-rays, expensive things like chemotherapy, kidney dialysis, infusion therapies. That's all under the Part B of Medicare. Right. Part C of Medicare, this is a bit of a misnomer. It's not really a part of Medicare. It's another way for you to take your Medicare benefits. So if you sign up for a Part C plan, it's also called Medicare Advantage. This is the fully privatized plan that replaces your Medicare coverage. So if you sign up for that United Healthcare or Blue Cross or Aetna, whatever carrier you sign up for that Medicare Advantage plan, that fully replaces your benefits. And they bundle everything together into that one plan. Your hospital, your medical, and your prescriptions, now all administered by one of those insurance companies. Okay? Most of those TV commercials you see, Joe Namath, William Shatner, Jimmy Walker, right? They're promoting all those extra benefits. They're really talking about more Medicare Advantage plans when those TV commercials. Okay, we're going to get into the differences in the presentation between Advantage plans and original Medicare. All right, Part D of Medicare is going to be the prescription drug coverage. All right, there's about 25 different Part D plans available in each state. We're going to discuss how we pick the most cost-effective drug plan. Those premiums can range from like $7 a month all the way up to $100 a month. But we're going to discuss later how do you pick the right drug plan based upon your situation. Right. Also at the bottom of this slide, it just talks about the premiums for each of these parts. Part A, most people don't pay a premium for. So Part A, as long as you've worked 40 quarters and contributed to Medicare and Social Security tax, there's no additional premium you pay. You've kind of paid into the system your whole life. If you don't meet that criteria, Part A is actually very expensive. It's over $500 a month for that Part A benefit. All right. Part B, most people pay the base amount, which is this year it's $164.90 per month. It's about 93% of Americans pay that amount. However, if you're in a higher income bracket, which we're going to touch on the next slide, you can pay a lot more than that $164.90 a month, all the way up over $600 a month for some of the top earners. All right. The Part C premiums, these are going to vary by plan. We don't get into specific Medicare Advantage plans, but just know that it can be as low as $0 a month for a Medicare Advantage plan, and there are some that go over $200 a month. Most people that are enrolling in an Advantage plan are going with those zero premium plans, but they can vary just depending on your area and the different options that are available. Right. So let's get into those income adjustments I was talking about for the Part B premiums. On this slide, you'll see these are the income tiers. There's 6 different income tiers that determine how much you pay for those Part B premiums when you sign up for Medicare. And again, the base amount this year is $164.90. That's if you're filing an individual tax return and you're $97,000 or below, or you're filing a joint tax return below $194,000. If you're above these income amounts, you see you have to pay more, for each of these income tiers, all the way up to the top bracket where you'd pay $560 a month if you're above $500,000 as a single or $750 as a joint filer. The tax return that's being used to determine these income adjustments is the last one the government's processed, which is always going to be basically 2 years behind. So as of right now, what's the last tax return the government's processed? 2021. It's March of 2023. Some people haven't even filed their 2022 tax returns yet, right? So they're using your 2021 tax return to determine your 2023 premiums and IRMAAs, okay? There's an appeals process for this because a lot of people retire, right? That's why they're going on Medicare, and then maybe they're no longer in that same income tier. So you can actually appeal if you're no longer going to be in that income tier. We're going to get into in a few slides how you're going to appeal these IRMAAs if you're no longer in that income bracket. All right? Before we get there, though, there's also an IRMAA for Part D as in drugs. So the one we just looked at was Part B as in boy, but for the drug plan, for the same income tiers, you have to pay this IRMAA. An IRMAA is income-related monthly adjustment amount. It's at the top of the slide there. But you pay this additional amount. So if you're in that first income tier, there's no IRMAA for Part B or Part D. You're just paying the premium for your drug plan, which again could be $7 a month, could be up to $100 a month, but there's no additional amount. If you're in the second income tier or any of these other income tiers, you pay an additional $12.20 a month, $31.50 a month, $50, and so forth, depending on what income tier you're in. Okay? The next slide is just the sum of those numbers. So this is really when we are having conversations with people, this is the number we're discussing, right? It's the total. If you're in a higher income bracket, this is the total amount you're going to pay the government for your Part B and your IRMAAs. Yes, question?
Are these tiers subject to inflation? Are they changes yearly?
The question is, are the tiers subject to inflation? Yes, and do they change yearly? So the answer is yes and maybe. So they do change, not every year, and just kind of depends on a number of factors. If you look in the orange font, those are all the things that changed. So there were a lot of changes this year with those income tiers, but you can see like the top income bracket didn't change, but the other ones did have some changes. Yep. Yes?
Sorry, one other silly question.
Yep.
So you retire, what have you, so obviously your income is going to go down. So does that mean year after year it will change based on your new income? I just want to make sure.
Yep, good question. So the question is, do these change year after year with your income changing? And the answer is yes, but again, it's going to be 2 years behind. So for example, if you're signing up for June of 2023 to start Medicare, the government's going to use your 2021 tax return to determine your 2023 premiums. Then at the end of 2023, in December, you're going to get another letter that's based on your 2022 tax return that's going to determine your 2024 premiums and income adjustments. Okay? So it's possible you may have to appeal this twice. And I'm going to talk, that's what I'm going to get into right now is the appeal process. If you've had a life event, the most common ones we see are work stoppage and work reduction. But this slide shows you there's 8 total life events that could result in a reduction in income. Then you use this form, it's called SSA 44. And basically, when you get that letter from the government that says, you know, based upon your 2021 income, you're going to have to pay all this extra money, that's when you start this appeal process. And it's 8 pages, this form, but it's really 1 page of information. You just check off, I've had a work stoppage, if that's your scenario, and you put in the date of the event, and you put your projected income for this year, 2023, right? This is you telling the government, because they don't have any other record, right? This is you telling them, I'm not going to make $250 anymore. I'm going to be making $150, or whatever the number is, and they just take your word for it. So and it says in this document, your signature as proof of, with perjury, at the risk of perjury, if you're, something like that. But they just take your signature as your proof that you're no longer going to be in that income. And then obviously 2 years later, when you do your tax return, if you come back in at $250, they're going to come back at you for the difference. But the assumption is, your income's going to drop. That's why they allow you to appeal these IRMAAs. And like I said, you may have to do this twice. So in that situation I described, you do it for your 2023. And then at the end of 23, when you get that letter based upon your 2022 income, you may have to do another appeal, and then it should be caught up from there. Yep. Good questions. Any other questions on the IRMAAs or the appeal process? Okay. So when do people sign up for Medicare? When should you sign up? So Medicare was created over 50 years ago. Most people were retiring at 65 or even earlier than 65, right? So they built this window around your 65th birthday. It's called the initial enrollment period. It's a 7-month window, 3 months before your birthday month, the month of your birthday month, and 3 months after your birthday month, okay? So for people that don't have other credible coverage, right? So if you're not working at a company like First Eagle and you don't have coverage through the company, this is the time you'd have to enroll. Okay, we're going to get into situations if you're working past 65 at a large company on the next slide. But for people that don't have other coverage or they're retiring before 65, this is the time you have to enroll to avoid any penalties or delays in your Medicare coverage. All right? The way this works, if your birthday in this example is September 10th, you become eligible the first of the month you turn 65. So your coverage, your effective date would be September 1st, the first of the month you turn 65. But you can enroll as early as 3 months before. So you can enroll as early as June 1st for that September 1st effective date. All right? If you miss this window and you don't have other credible coverage, like from an employer plan, that's where the penalties come in. All right, so it's a 10% penalty for every year you don't have Part B when you're supposed to have it. So if you waited 2 years or 3 years, you're paying a 20 or 30% penalty on these Part B premiums. For the rest of your life, you'd have to pay that penalty. All right? So again, that's really for people that aren't working past 65. However, we have a lot of people that are working past 65, right? So there are these rules that determine which insurance is going to pay your claims if you're working past age 65. They're called the secondary payer rules, or Medicare secondary payer rules. They're federal law. And this slide explains who's going to pay your claims first if you're Medicare eligible and you're working past 65. So the first two rows, if you work for a small company, so obviously not First Eagle, but if you work for a small company with less than 20 employees, Medicare is primary. That means you have to sign up for Medicare at 65. Okay, you can't stay on that small group health plan because it doesn't have to pay for 80% of your claims, right? So if you're in that small group, or maybe you're covered on a spouse's plan who works for a small company, then you have to sign up at 65 because Medicare is going to pay the first 80% of your claims. All right? If the company has more than 20, like First Eagle, and you're covered on the group plan, you can stay on that group plan as long as you continue to work. Okay? It's going to continue to pay your claims as primary, and you're going to have no problems with anything when you go to sign up in the future. We're going to explain how you're going to sign up if you're enrolling after age 65 later. It's optional in that second scenario. If you want to compare, we help people with a comparison to say, this is what it's costing me to be on my group health plan. This is what it's going to cost me and what the coverage is going to be like to be on Medicare. If you're a higher income earner, it's probably not going to make sense to go to Medicare, right, because of those IRMAAs that you're going to have to pay. But that's something you can look at and we can help with if you want to do that comparison when you're turning 65. The third and fourth rows of this table is for another way you can qualify for Medicare, which is if you're on Social Security disability for 24 months, you also become eligible for Medicare. So you could be 35 years old, 40 years old, and be on Medicare due to disability, for example. If you qualify for Medicare due to disability, these secondary payer rules are a little bit different. So instead of 20 employees, they're looking at a company less than 100 employees where Medicare is primary, and 100 or more employees where the group health plan is primary. All right?
So either way, you have to sign up for Medicare by the age of 65, unless you get a penalty, then you'll get a penalty.
No. So the question was, either way, I have to do something at 65, I have to sign up. And you're going to get bombarded, when you get close to that point, you're going to get bombarded with marketing, with mail, with commercial. You're just going to be, and people get anxious and they think, I have to do something. If you're working at a company more than, like First Eagle, and you're covered on the health plan here, you do not have to do anything at 65, okay? It's optional if you want to sign up for Part A, because it's premium free. You can sign up for Part A, hospital benefit. You don't pay any premium for that. You get your Medicare card in the mail. It's got your name and your Medicare number, and you're in the system. The only downside of doing that is you can no longer contribute to an HSA health savings account. Marissa, is there an HSA? Oh, you do. So you would lose the ability to contribute to the HSA and get the tax benefit of the HSA. So, if you have an HSA, I would say do nothing. And just if you're working past 65, just stay covered on the group plan. When you go to sign up in the future, we'll get into the forms you need so you don't have any penalties or any issues later. So, yep. Good question. The last two rows in here, if someone has a retiree health plan, so if your spouse, for example, a spouse is a teacher for 25 years, certain states offer a retiree health plan, that becomes secondary to Medicare when you turn 65. So you still have to have your Medicare A and B, and then the retiree plan is secondary. All right? The last row of this table, and this can be a very confusing issue for a lot of people, if you're Medicare eligible, so let's say you're working here and you're 67 now, right? So for those, you turn 65, 66, you had no issues with your insurance, right? Everything keeps paying your claims. It's a large group health plan, no problem. Now you leave the company and you get this letter from HR about COBRA, right? It says you can keep the same coverage you have for 18 months. You pay 100% or 102% of the premium, right? And for a lot of people, it's a seamless experience. This is the insurance I had. It's just, I don't have to think about it. I'm just gonna do the COBRA. Well, you have to be careful here. So COBRA becomes secondary to Medicare when you're Medicare eligible. So what does that mean? You can do the COBRA, but then you still have to sign up for Medicare A and B, or that COBRA insurance doesn't have to pay for 80% of your claims, right? So you're still paying the full COBRA premium, but it's secondary to Medicare when you're Medicare eligible. All right, that's one issue with COBRA after 65. The other issue is COBRA is generally 18 months. There's a couple of nuances with that, but generally it's 18 months is how long you could keep the COBRA. So for someone at 67 or 70, they sign up for the COBRA and they don't sign up for Medicare because they didn't realize they had to. And they go the full 18 months of COBRA, and then they go to sign up for Medicare, and Social Security says, no, you can't sign up right now. You get an 8-month special enrollment period after you leave work to sign up for Medicare without any penalties or delays. So if you go 18 months of COBRA, and then you go to try to sign up, the only time you could sign up then is, which happens to be right now, is the general enrollment period, which is January 1st to March 31st. That's for people that missed their window. And that's the only time all year you're allowed to sign up. And you could have that penalty, that 10% penalty as well on your Part B premiums for the rest of your life. So we call this the COBRA trap. It's one of the issues we've been fighting in Washington and trying to get resolved. We've had legislation drafted for 4 or 5 years now, and it's got bipartisan support. It's just not getting prioritized to get this thing fixed. But just something to be aware of. If you're going to retire after 65, COBRA probably isn't going to make sense because you still have to have the Medicare A and B in place. All right? Any other questions on the secondary payer rules? No. All right, so this next slide shows you if you're ready to sign up for Medicare, there's kind of 3 different scenarios that you'd sign up or how you'd sign up for Medicare. The first one is if you're turning 65 and you're already enrolled in Social Security, you're already getting a Social Security check, you're actually going to be automatically enrolled in Medicare A and B. The government's just going to mail you your Medicare card about 3 months before your birthday, and it's going to have your Medicare number and your Part A and Part B effective dates on that card. The second scenario is if you're turning 65 and you're not enrolled in Social Security and you want to enroll in Medicare, the easiest way to do that is right on the Social Security website. It takes about 5 or 10 minutes, and you get your Medicare card about 3 to 4 weeks later. And that's you can also, if you don't want to do it online, you can do it over the phone or you can go to the office, but it's much easier just to do it online in that second scenario. Now, the third scenario, which is becoming more and more common, is people working past the age of 65. And this is where you're going to need 2 forms to sign up for Medicare. And the first one is the enrollment in Medicare Part B, which you're going to fill out and sign. And it's pretty straightforward, name, address. In the remarks section of that form, you put your requested effective date. So I want June 1st, 2023, and you sign that form. The second form is more important. It's the employment information form. And that's the one that has to be filled out by Marissa or someone on Marissa's team that shows that you were covered on the group health plan since you were 65. Okay, it's a 1-page, again, these are all like 4 pages, but it's 1 page of information you actually have to fill out. But it's just got some key dates on it as far as your employment dates and your insurance dates that you were covered on the group health plan. And that second form, again, is how you avoid any penalties or delays with your Medicare coverage. Once you have these forms completed, we actually recommend you physically go down to the Social Security office and drop these forms off. Someone will look at those forms, make sure they look correct, and that starts the process for the Part B enrollment. You don't have to go down there. You can mail them in, you can fax them in. There's an online portal now where you can upload those forms. But we've had the best success with people that go down there, and someone looks at them and makes sure everything looks good. So you're not waiting 3 or 4 weeks just to find out there's something wrong with the form, and you wait another 3 or 4 weeks and so forth. So, all right.
If you turn 65 and you're not employed any longer, but you're on your spouse's plan, do you need to do anything at that point?
Good question. So the question is, if you turn 65 and you're no longer working here, but you're covered on your spouse's plan, do you have to do anything? So it's going to go back to those secondary payer rules. So it depends on your spouse's employer size. So if it's less than 20 employees, then yes, you have to sign up for Medicare A and B because it's going to become your primary insurance. If it's a large company, more than 20 employees, you can stay covered on your spouse's plan just like you're covered here. I will say, in a lot of cases, covering a dependent costs more than covering the employee. So we'd recommend like a comparison in that scenario to say how much is it costing the spouse to cover the husband, and is it worth it, right? Is Medicare going to be more cost effective or not? It just kind of depends. So, all right, good question. All right. I think this is yours, right? I'm going to hand it over to Rod Spann. He's going to take us through the differences between original Medicare and Medicare Advantage.
Excited to talk about Medicare? All right. No one's ever excited. It's okay. All right. So now you've made the decision you're going to sign up for Medicare, right? So you have your red, white, and blue card, and you're ready to go. So everyone has a choice at this point. Are you going to go the original Medicare route, supplemented by a Medicare supplement plan or a Medigap plan, or the Medicare Advantage route? The important thing to remember is that you can't go in both directions, right? You cannot have a Medicare Advantage and a Medicare supplement. You have to choose one or the other. if you look here to my right, your left, the original Medicare route, you're obviously going to be enrolled in Part A and B, which is your hospital and medical insurance. As Justin noted, and we're going to get into it a little bit further, you pick a standalone Part D prescription drug plan that's tailored to your specific combination of medications. And then you pick a Medicare supplement policy. These are federally regulated and standardized policies that, in essence, they do exactly what their name implies. They supplement what original Medicare does not cover. They fill the gap, right, Medigap, that's left behind for Medicare. That's the original Medicare route. It's more of the a la carte type of choice. On the other hand is Medicare Advantage, also known as Part C of Medicare. This is where all of your benefits, generally Part A, Part B, and for most of these plans, Part D prescription drug coverage, are all bundled into one fully privatized medical insurance policy. Right? This is more like an HMO or a PPO, very similar to the insurance that you may have now, where there's co-payments, co-insurance, deductibles, and stuff like that. So that's the main difference. And as we mentioned, you can't have Medicare Advantage and a Medicare supplement policy at the same time. In fact, it's actually illegal for someone to try to sell you one if they know that you have the other. All right? Any questions about those main differences? Yes, ma'am.
Where is dental and vision covered?
Okay, where is dental and vision covered? So on original Medicare, there is no dental or vision coverage, not for anything that's not medically necessary. So original Medicare will cover like wet macular degeneration, cataracts, glaucoma, but they won't do like regular vision checks or if you want to get your teeth cleaned or something like that. Oftentimes you will find that in Medicare Advantage policies, which we'll get into in a little bit.
Can you get a Medigap policy if you do the original Medicare route?
Yes. Can you get a Medigap policy if you go original Medicare? Yes, that's actually the only way that you can get a Medicare supplement or a Medigap policy, is if you're on original Medicare.
A Medigap policy that covers dental and vision. Can you make yourself whole in the original Medicare route?
Okay. Can you make yourself whole in the original Medicare route? I keep repeating the question.
Yes.
So there are standalone policies that you can get to cover dental and vision, right? It's not under Medicare, but there's companies that offer dental, vision, and hearing insurance to make yourself whole while still keeping original Medicare and a Medicare supplement. That make sense?
Yes.
Okay. So you won't be without. All right. So what are some of the main differences between a Medicare supplement and Medicare Advantage? First and foremost, we'll look at those first two lines, the relationship to Parts A and B. And this is important. With a supplement, again, it supplements original Medicare. With an Advantage plan, it replaces it. All right? So think again about that red, white, and blue card. When you have original Medicare and a supplement, when you go to the doctor, you turn in that red, white, and blue card as well as your supplement card. When you have an Advantage plan, they actually tell you to put your red, white, and blue card away someplace safe because you're no longer going to use it, right? Even though you still have to pay the Part B premium, you're fully covered by that company, whoever is offering you that Medicare Advantage plan. And that also kind of correlates to the private network aspect. On original Medicare, there is no private network. You can go to any hospital, any provider that participates with Medicare, and right now that's close to 90%, or it is 90% of providers and 99% of hospitals, anywhere in the United States of America and its territories. Right? So that's original Medicare. It's not a private network, and it's very, very good coverage. On Medicare Advantage plans, generally, as we mentioned earlier, you're going to be on an HMO or a PPO-like plan where you have to go to the doctors and the providers and the facilities in that specific plan, right? So it's a little bit narrower of a network. In regards to referrals, right, the need to see a specialist, with original Medicare, you never need a referral to see a specialist. If you need the care, as long as they participate with Medicare, you can go there, right? And as long as Medicare covers it, which is something they consider to be medically necessary, your Medicare supplement will follow along right behind it. In regards to Medicare Advantage plans, referrals oftentimes are going to be needed, right? So that's where you have to go to your primary care physician. It's between you and your doctor to coordinate your care to get you the referrals to see your specialist. There are some plans that do offer no referrals necessary. but those are generally newer. For the most part, the majority of these plans you're gonna need referrals to see specialists. Fourth, Part D, which is prescription drug coverage. With original Medicare and a supplement, again, you have to pick your own standalone Part D plan that's tailored to your combination of medications. With Medicare Advantage plans, drug coverage is all bundled in to one plan. So it's all one instead of picking your individual plans. And then lastly, this is what most people really focus on and really what they harp on when you see these commercials, right? William Shatner, as Justin mentioned. And I can guarantee you none of those guys have a Medicare Advantage plan. But nonetheless, what they really focus on is the premium for these plans, right? Oftentimes focusing on $0 per month. And so that's what we see. The majority of these Medicare Advantage plans are going to be very low premium, many of them $0 per month. Whereas a Medicare supplement is going to be more than $0 per month. And that premium can vary, so we won't get into specifics, but it varies depending on your age, your gender, and zip code. All right, so that premium is going to be a little bit higher. On the flip side, right, if we're not focusing just on premium, which is that monthly premium that you pay every month, the annual out-of-pocket cost, right? With a Medicare supplement, you pay a higher premium, but your out-of-pocket cost is minimal, right? We're going to go into 3 of the most popular Medicare supplement policies. And the one that's most popular right now, your out-of-pocket is limited to just $226 for the year. So after that deductible, you pay nothing else for the rest of the year. On the flip side, a Medicare Advantage plan, you're not paying anything per month, but you have co-pays, co-insurance, deductibles, all the way up to the federal maximum of $8,300. All right, so there's where you see the variance there. Another important aspect is guaranteed renewability for life. What does that mean? Does anyone know? Guaranteed renewable for life. Sounds good, right? Basically what that means is with a Medicare supplement, as long as you stay alive, you stay enrolled in your plan, and you pay your monthly premium, no one could ever take your Medicare supplement away. All right, you will never lose your Medicare supplement. Even if that company goes out of business and they no longer deal in the Medicare space, you will never lose your Medicare supplement. You will always be guaranteed renewable for life. You'll always have coverage. That's not necessarily the case with Medicare Advantage plans, which change every year. Doctors come in and out of network with these plans. Hospitals, entire hospital systems will come in and out of network with these Advantage plans. And generally, that's, again, where you're going to see a lot of these commercials during the annual election period. That's when a lot of these changes are taking place in this Medicare Advantage space. And then lastly, as was mentioned earlier, other benefits. Medicare and Medicare supplement, you're 100% covered for your medically necessary services, and there's not a lot of extra benefits. But on the Medicare Advantage side, that's where they offer, free rides to the hospital or to your doctor's visits, dental, vision, a couple bucks towards hearing aids, OTC benefits, so you get a few dollars towards vitamins or whatever you need for your house or something like that. But Medicare Advantage plans, they offer those, right? They tout those benefits. That's really what they focus on. And again, we're not here to say that one plan is better than the other, right? Everyone's going to make their own choice. But it's important to understand the difference between these 2 pathways of Medicare. Oftentimes, people will use Medicare Advantage synonymously with Medicare supplements. But as we can see, they are not the same, right? And so it's important to understand what the differences are so that you, or those that you love, can make an informed decision and have a plan that works best for them. All right? Any questions? Yes, ma'am?
So if you do a Medicare Advantage plan, Part C, and you find that their dental, vision, or whatever that is not sufficient in that plan, you can't get a Medigap policy, but you can get a private dental or vision insurance?
Okay, good question. So if you have a Medicare Advantage plan and you find that the dental, vision, or hearing is not robust enough, you cannot pick up, it's true, you cannot pick up a Medicare supplement, but you can pick up additional coverage in the just dental, vision, or hearing if you would like.
Can you also do that with original Medicare?
Yes.
Okay.
Yes, most definitely. Yeah, with original Medicare, if you go the original Medicare route with a Medicare supplement, you can get standalone dental, vision, and hearing that's tailored to whatever it is that you need. You can do that. The only thing you can't do is have a Medicare supplement and a Medicare Advantage plan at the same time, because they do not coordinate. They don't operate the same. All right? Yes, sir?
If you go into the Medicare Advantage, let's say that's your choice, whatever works out, a couple of years later, not working out for you, you want to go back into the original Medicare A and B, you face the 10% penalty, or is it just an easy transfer?
Okay. We will get into that, and I'll answer that question. I'll repeat it, and then I'll answer it, all right? But we're going to go just briefly into 3 of the most popular Medicare supplement policies. And they all look very generic like this because, as I mentioned earlier, Medicare supplements are federally regulated and standardized. So what that means is that the government sets the terms of how these plans have to operate. And even though there's private companies that administer these plans, they all operate exactly the same, right? Page 9 of the Choosing a Medigap policy states very clearly, right, that generally the only difference between any Medicare supplement policy is the monthly premium, right? So those premiums are the only things that are going to be different. But every Plan F, every Plan G, and every Plan N that we'll discuss is going to look and operate exactly like this, all right? So Plan F, Medicare supplement. This is used to be the gold standard when it came to Medicare supplements. Unfortunately, unless you qualified for Medicare before January 1st, 2020, not that you needed to be on Medicare, but you needed to qualify for it before January 1st, 2020, you actually can't get Plan F. But nonetheless, it's still a great example to use. Why? Because Plan F, you pay nothing, right? You pay your monthly premium for this Medicare supplement policy. And as you can see, between Medicare and your Medicare supplement, you have no out-of-pocket expense. We use the first 60 days in the hospital as an example. So if you only had original Medicare, that red, white, and blue card, you go into the hospital, you're responsible for the first $1,600. That is called the Part A deductible. With Plan F, Medicare supplement, that deductible is covered. God forbid you're in the hospital more than 60 days. Days 61 through 90, now it turns into a $400 a day copayment. If you had no supplement, you'd be responsible for that. With the Medicare supplement, Plan F, that's covered 100%. And as you can see in the bright neon green, that's all we need to focus on. You're responsible for nothing, right? This is how Part F, or Plan F, participates or works with Part A of Medicare. Now, for Part B, which is everything outside of the hospital, it operates exactly the same. That first $226 is referred to as the Part B deductible. With Plan F, that Part B deductible is covered for you. And then after that, Medicare pays their 80%. Your Plan F Medicare supplement pays the other 20%. So you are 100% covered for your medically necessary services. Once again, bright neon green, you pay nothing. You have no out-of-pocket expense. So that's why a lot of folks really, really loved Plan F. But again, if you didn't qualify for it before January 1st, you actually can't get a Plan F. But all is not lost, all right? Plan G is now probably one of the more popular Medicare supplement policies because, as you can see in the very bold letters on top, Plan G is exactly like Plan F, except for what? Who's my winner here? I'll answer, okay, the deductible, all right? So with Plan G, it operates exactly like Plan F, except you, as the beneficiary, are responsible for that first $226. So first or second doctor's visit, you get a bill in the mail for $226, and that's it for the rest of the year. No co-payments, no co-insurance, no other deductibles, that's it. So Plan G right now is extremely popular, and it's just very cost effective. Now another very popular plan is also Plan N, especially here in New York, right? Most of y'all live here in New York? No? Okay, well, it's popular in New York nonetheless, all right? So Plan N is popular because it's exactly like Plan G. So you're still responsible for that first $226. First, second doctor's visit, you get that bill. And then on top of that, you're also responsible for up to $20 for every office visit and up to $50 for every emergency room visit. All right, so this is one of the few plans that actually has a co-payment kind of built into it. And then lastly, Plan N also has what's referred to as Part B excess charges, which is basically 15% more than the Medicare approved amount. So Medicare has an approved dollar amount for every service imaginable, If a doctor wants to work with Medicare, they accept it. They say, we'll take that dollar amount. Once per year, they're able to say, I want to charge it a little bit more. Medicare will still work with them, but they're only able to charge up to 15% more. It's not pick and choose, it's just all the way across the board. And with Plan N, you're responsible for those excess charges. Thankfully, here in New York and Connecticut and a few other states, excess charges are actually prohibited. So that's why Plan N is actually very popular here in New York, because there are no excess charges, and Plan N is generally going to be a little bit more cost-effective, lower monthly premium. All right? Any questions about Plan F, Plan G, or Plan N? We're still good? All right, we're golden. Thank you. All right, so when can you actually get into any of these Medicare supplement plans? I forgot your name. What was your name, sir? Yours. Al. All right. Al had a really good question about switching from a Medicare Advantage plan going into a Medicare supplement. All right. So to answer that, we'll focus on this first, the open enrollment period. You can get into any Medicare supplement policy during this open enrollment period. And there's these two ones that we focus on are basically when you first sign up for Medicare Part B. So when your Medicare Part B becomes effective, you have 6 months to get into any Medicare supplement policy that you qualify for, no questions asked. All right? You also have another open enrollment window, as Justin mentioned, because you're able to go on Medicare before the age of 65. If you've been on Social Security disability for more than 24 months, you go on Medicare. If you have end-stage renal disease, or if you have ALS, Lou Gehrig's disease, you automatically go on Medicare. So if you're in that situation that you're on Medicare before 65, when your 65th birthday rolls around, you have another 6-month window to get into any Medicare supplement policy, no questions asked. And now for a person who's on Social Security disability, this is generally going to be one of the last opportunities they have to get into one of these Medicare supplements to get that 100% medically necessary coverage. All right? And to go to that specific question, let's say you start with a Medicare Advantage plan and you're on it for a few years. This same rule would apply. If you're outside of this 6-month window and you've had coverage through another policy and you want to get onto a Medicare supplement, now you're subject to medical underwriting. So they're going to, not that you need to go in and get blood drawn, take some tests, but really, that's our job as field underwriters, is basically to ask you a few questions where they're looking at your health history, your medications, they're looking for serious things, and they can either accept your application or deny you, right? So most people who are going on Medicare and making what we consider to be a lifetime decision are making the choice either to go to a Medicare supplement right off the bat or the other route. But it's a very serious decision. All right, does that answer your question? Golden, thanks.
So you can switch. There's just you could potentially get denied.
Yes.
And then the other way too. So if you do Medicare supplement and you decide later on you want the Medicare Advantage, you would go through the same process.
Okay, so the question is about possibly being denied going to a Medicare supplement or Medicare Advantage. So for Medicare supplements, outside of that 6-month window, you can be denied because they're the only ones with underwriting. With a Medicare Advantage plan, there is never any underwriting. It's only timing, right? For Medicare Advantage plans, you can only enroll when you're first enrolling onto Medicare, and outside of that, it's the annual election period, October 15th through December 7th. Anyone can get into a Medicare Advantage plan, no questions asked. There is no underwriting for Medicare Advantage plans. All right? Good questions. All right? So now I'll give it all back to Justin. There you go.
Thanks, Rod. Yep. Great job. Ready for the confusing part? All right, so we're going to get to the last part here, which is Part D of Medicare, which is the prescription drug coverage. We mentioned earlier there's about 25 different Part D plans available in each state. Now, all of those plans have to follow certain rules. So this slide here explains those rules, or we call them steps within Part D of Medicare, just so you have the framework and understanding of how this works. The first step is the deductible. So these drug plans can have a deductible. This year it's up to $505. So it can't be any higher than $505. It could be $0, it could be $200. Most of these plans take advantage of that, and they're $505. You have to pay a lot higher premium to get a zero deductible drug plan. All right. Now, most of these plans also, even if they have a deductible, it doesn't apply to like the tier 1 or the low-cost generic drugs. It's for those higher tier, like brand name drugs. Right. The second step here is called the initial coverage level, and 85% of Medicare beneficiaries aren't going to get past this second step. As long as your drug costs for the year are less than $4,660 based on the retail cost of your drugs, then you're just going to pay a copay or coinsurance, which it shows at the bottom there. That's what, $5, $10, $40, whatever. You're kind of similar to a group insurance plan. It's going to feel kind of similar. Where it stops feeling similar is this third step. And again, this only affects people that have very expensive medications. But if you have more than $4,660 of drugs, retail, you fall into the third step, which is called the coverage gap. It's also called the, anyone know? Donut hole? Have you heard this expression? No? Part D donut hole, they call it, where you have to pay 25% the cost of your drugs. So if you have those and I'm going to give you a quick example to help simplify this, but if you have expensive drugs, at some point in the year, you're going to get into this third step, and instead of paying that $40 copay, now you're paying 25% the cost of the drug. Okay, it's very confusing. It can be very expensive for people. And then there's another step to protect people that have extremely expensive drugs, which is called catastrophic coverage. So you're not stuck paying that 25% the entire back half of the year. You'll eventually pay 5% instead of the 25%. All right, so that's to protect people on the other side of the donut hole, which is called catastrophic coverage. Now, just to give you a quick example to simplify this, first of all, any commercial you see for a medication is going to hit you in the donut hole, right? Those are the drugs that are very expensive and there's no generic alternatives. Some of the common drugs we see that are expensive are Eliquis and Xarelto. These are heart medications. The retail cost of that drug is about $600 a month. All right, your copay might be $45, right? So just to give you an example, assuming you don't have a deductible for simplicity, you go to pick up that drug in January, it's $45, February, $45, March, $45. Every month's $45. You go, and then you go to September, and you go to pick up that same medication, and instead of a $45 copay, the pharmacist says that's going to be $150. Wait, that's got to be wrong. It's $45. That's my copay. Well, what happened here? So 9 months into the year, 8 months into the year, times that $600 a month retail, now you're past that initial coverage, right? The $4,660, right? So now you're in the donut hole, and you're paying 25% of that $600 retail, which is $150, right? So that's how, and I just use one drug to simplify it, but it's based on the total cost of your drugs for the year, and that's how that donut hole works. And I don't want to confuse you with how you get to catastrophic because it's apples and oranges. It's retail costs to get into the donut hole, and it's called true out-of-pocket cost to get out into catastrophic, but it's not what it sounds like. You don't have to spend $7,400 of your money to get to catastrophic. It's roughly, just to give you rough numbers, if you have expensive drugs, you're probably going to spend about $1,500 to get into the donut hole and probably another $1,500 or so to get out into catastrophic where you're only paying 5%. All right? So I just give you those terms because that's you have the framework of how these Part D plans work. There are some changes I mentioned in that Inflation Reduction Act from last year that affect drug costs going forward with Medicare, listed on this slide. One was there was a $35 a month cap on insulin, which was actually put in place years ago in an executive order. This bill just extends it and puts it in legislation. So if you have insulins and they're covered on your drug plan, it can't cost you any more than $35 a month. This bill also put in a zero-cost vaccine cost sharing. So for certain medications for vaccines, there's some that are covered under Part B as in boy. So they were already zero cost, like flu shot. However, shingle shot, for example, is covered under Part D as in drugs. And so you used to have to pay $150 for a shingle shot. Now it's zero cost as of this year. Premium stabilization was in the bill as well. That says that the drug plans can't increase the premium more than 6% per year starting next year. The big changes are coming in 24 and 25 with those Part D benefit levels that we just went through. So I'm going to quickly show you those. And then there's also drug price negotiation, which the government was never able to negotiate drug pricing before. Now they can negotiate, and the effects of that will take effect in 2026 and after. Okay. So what's changing in those charts we just looked at? So for 2024, we don't have all the numbers yet as far as what the deductible, initial coverage, and so forth. But the big change is once you reach catastrophic coverage, you used to have to pay 5%. Remember I mentioned that was the fourth step? In 2024, you pay 0. So it kind of puts a max amount of pocket on your drug costs, roughly about $3,000, $3,500 for the year starting next year. And then in 2025, this whole thing kind of gets thrown away. There's no more donut hole. There's no more catastrophic. Now there's a $2,000 maximum. So once you hit $2,000 of drug costs, you're going to be done for your drug costs starting in 2025. And that will be inflation adjusted. All right. This just shows you year by year the impacts of that bill. The one thing I'll highlight, and I said this earlier, in 2026 is when the first reduction in drug pricing is going to come for those 10 most expensive Part D drugs, which I'm going to show you on the next slide, which most likely those drugs are going to be. And then after that, they're going to be negotiating even more Part D and Part B drugs, which we'll see in future years as well. Right now, the 10 most expensive Part D drugs are listed on this slide. The most common ones we see are, like I said earlier, Eliquis, Xarelto, Januvia. A lot of these are diabetes meds that are not considered insulin. So, and then Humira is like $6,000 a month, ridiculous expensive medication. And then these are the Part B drugs. Most of these are going to be cancer infusion type therapies that are very expensive. And again, Part B drugs these are things that are administered by your doctor. So they're covered under your Part B coverage, not your Part D. All right. This I'm going to actually send out just because for the sake of time. There's a little demo video of how we pick the most cost-effective drug plan. So we'll send Marissa these resources that she can distribute to everyone after the presentation. It's about a 15-minute video, but it shows you it's a tool on the Medicare website. It's what we use for all of our clients to find the most cost-effective drug plan. And you basically just put in your zip code, your list of medication, dosage, frequency, and the tool does all the work for us. And it calculates the total overall expense for the year for each of those 25 plans based upon your specific list of medications. And then it sorts the list based upon the lowest total cost for the year. So we're not just looking for the lowest premium, or we're not just looking for the lowest drug cost, we're looking for the lowest total cost to find which is going to be most cost effective. Generally, the one that comes to the top of the list is going to be the best plan for that year for that person. And you can change that every year. So the drug plans change every year. Even if your drugs don't change, those plans will change. The formulary, the copays. So you want to review this every year. We send reminders to all of our clients in September every year to get their latest drug list. And we rerun that drug analysis each year to make sure they have the right drug plan for the following year. All right. So I'll send out the link so you can, if you want to watch that video, to see how we pick the right drug plan. So there's a couple of other prescription assistance programs that are out there. These are not Part D. So if you're going to use some of these, you still need to have a Part D drug plan. If you don't have a Part D plan, some people say, I'm not taking any medications. I don't need Part D. Well, there's two reasons why you need it, right? What if you are prescribed something that's very expensive? You're going to pay 100% of that if you don't have a drug plan. Number two, there's a penalty. The government charges a penalty of 1% for every month you don't have a Part D plan when you're supposed to have it. So if you wait 2 years, 24% penalty on those Part D premiums. For the rest of your life, you have to pay that penalty. All right? But these are additional discount programs that you can use that sometimes have lower costs than your Part D plan. So for whatever reason, there's certain prescription lotions, creams, ED meds, inhalers that have lower costs using coupons on GoodRx than actually using your Part D plan. So that's another resource that's out there. And these other ones are just other examples. And then in each state, there's also, for lower income folks, there's additional prescription assistance programs that are out there. All right? So we went through that kind of fast there. Any questions on the Part D coverage? Okay, I'm going to quickly recap now those top 5 mistakes people make on Medicare. The first and the biggest mistake we see people make is not enrolling in Medicare Part B on time. Okay, and this can be 2 ways. So it could be enrolling too late, you missed the window, and you don't have other coverage, and you're going to have that penalty, and you're going to have delays the rest of your life. You're going to have the penalty the rest of your life, and you have delays for your Medicare coverage. But it can also be the opposite. We see people, high earners, turn 65 and they're still working, and they think they have to do this. They have to sign up for Medicare. They're getting all this, scary mail, and they say, oh, I'm just going to do it. And they're paying years and years of these premiums and these IRMAAs for something they don't need because they're still working and they're covered on a large group health plan. Okay, so this is the biggest mistake we see from an impact perspective and also a volume perspective, is not enrolling in Medicare Part B on time. The second biggest mistake we see people make is not analyzing their prescription drug costs. Okay, if you watch that demo video, you see if the difference between the top plan in the list and the one that's number 25, if you have expensive drugs, it could very well be thousands of dollars a year. I think in the example, it's about a $7,000 difference if you watch that video. The person has a couple of expensive drugs in the example, but if you pick the wrong plan, it could definitely be very different costs for you. And you could change that every year. So we recommend reviewing that every year between October 15th and December 7th to make sure you have the right drug plan for the following year. The third biggest mistake we see people make on Medicare is not understanding the differences between Medicare Advantage and Original Medicare with a supplement. Okay, Rod went through all those differences, two very different types of coverage. Remember, the Advantage plan is the fully privatized plan. It's basically managed care, right? So the insurance company is the one making your decisions. You might need prior authorization or pre-approval to get an MRI or an X-ray. You don't have those same network restraints with Original Medicare and so forth. Just two very different types of coverage. Most of the marketing and the TV commercials you're seeing are for the Advantage stuff. The insurance companies make a lot more money on the Advantage plans, right? You're paying zero premium. Are they giving away free insurance? No. What's happening? The government's paying them about $1,000 a month to have you off of Original Medicare. The government's washing their hands, right? They're done dealing with you. When you sign up for that Advantage plan, they're paying the insurance company to manage you. They're not handling your phone calls, your claims. You're done with Original Medicare. So just understand there are very different types of coverage between the Medicare supplement and the Medicare Advantage plans. And then the fourth biggest mistake we see people make, and this really would only impact you if maybe your spouse has like a retiree health plan, but there's people that have, let's go back to the teacher. If you teach for 25 years, you don't pay any premium. It's probably best to take that retiree health plan. We have other teachers that taught for 23 years, and it costs them $400 a month for that retiree benefit. And they could do a lot better on their own, just getting a supplement and a drug plan with better coverage for lower premiums. But they think it's a benefit, and they just go with it's a retiree benefit, so they don't even analyze the options. And the fifth biggest mistake is listening to your friends and family. And we joke about this, but it happens all the time. We get these phone calls, my neighbor has this plan, my cousin, even my spouse, right? Especially with the drug plans, right? It's all very specific to what your medications are. Medicare is individual policies. You want to pick the right coverage based upon your particular situation. All right? And we wrapped up there pretty quickly, but I wanted to get through everything. Any other questions? Anyone? All right. Well, we are here, as I mentioned, to help you folks. If you have any Medicare questions, if you have friends or family that are turning 65 and they just have questions or they need help enrolling, that's what we're here for. I'm happy to help you or your friends and family when that time comes. And we appreciate everyone coming out today for the workshop. So thank you.